From California, Ms. Barragan, for her 5 minutes of questions.
Thank you, Madam Chairwoman. Dr. Bright, one striking aspect of your account and your complaint to the Office of Special Counsel is the contrast between the public updates by the President and Secretary Azar on COVID-19 versus the analysis you and other experts were providing behind the scenes. I'd like to explore this disconnect and ultimately that the administration shared information that I believe was misleading. We need to do this to better understand what happened and how we can ensure that the administration provides the public accurate and constructive information going forward. Dr. Bright, you had learned of the COVID-19 threat by early January, is that correct?
Yes.
And according to your complaint, it was clear to you almost immediately that the, quote, virus was highly contagious, spreading rapidly, and could have a high mortality rate, end quote. Is that correct?
We were learning that from the outbreak in China at the time, yes. And each day we learned more information, it was actually more concerning.
And the World Health Organization confirmed your view that the virus was a big problem in a January 20 call to agencies, including HHS. Over the course of January, you pressed HHS leadership about the urgent need to devote increased resources to address the outbreak. On January 23rd, you briefed Secretary Azar directly that funding, personnel, and clinical specimens, including viruses, were critically necessary to begin development of life-saving medicines needed in the likely event the virus spread beyond Southeast Asia. Yet, on January 24th, in a tweet regarding the virus, the president asserted, quote, it will all work out well, end quote. On January 29th, Secretary Azar reportedly told the president that the epidemic was, quote, under control. And the president echoed that comment publicly the following day. This disconnect between the analysis of public health experts and the public statements by the administration leaders continued through February. Let me give you some more examples. In early February, you continued to raise the alarm bell within HHS about the imminent mass shortages and the lack of preparations for the wave of infections that you saw coming. Thank you for doing that. Yet, in public remarks on February the 10th, President Trump stated, it looks like by April, in theory, when it gets a little warmer, it miraculously goes away, end quote. Then he added, I think it's all going to work out good. We only have 11 cases, and they're all getting better, end quote. You have said that experts knew that the number of N95 respirator masks needed to protect healthcare workers and other Americans in a pandemic was close to 3.5 billion. Yet, in testimony on February 25th, Secretary Azar said the U.S. would only need 300 million N95 respirators. That's an order of magnitude so much less than what you stated. Throughout February, you continued your warnings. I would say that your hair was on fire about the dangers of millions of Americans faced from this virus. But on February 26, President Trump characterized the number of cases this way. Quote, when you have 15 people, and the 15 within a couple of days is going to be down to close to zero, that's a pretty good job you've done, end quote. By March 10th, there were over 1,000 diagnosed COVID-19 cases in the United States, and over 30 deaths had been attributed to the virus in this country. Yet the president that day told the country, quote, it will go away. Just stay calm. It will go away, end quote. He couldn't have been more wrong. Today we have over 1.4 million cases. Dr. Bright, what impact do you believe that statements by the administration leaders downplaying the COVID-19 crisis throughout February had on the ability of our public health system to mount an effective response to the COVID-19 virus?
I believe Americans need to be told the truth. I believe that the best scientific guidance and advice was not being conveyed to the American public during that time. I believe by not telling America the truth or being fully transparent, regardless of where the information was coming from, people were not as prepared as they could have been and should have been. We did not forewarn people. We did not train people. We did not educate them on social distancing and wearing a mask as we should have in January and February. All of those forewarnings and all those educational opportunities for the American public could have had an impact on further slowing this outbreak and saving more lives.
Well, thank you, Dr. Breyer. I want to thank you for sharing your perspective with us today. I hope that over the course, I hope that your courage in coming forward helps our country forge a better path in the disastrous course chartered by this administration to date. I yield back.
Gentlewoman yields back, minority.